Welcome to America's Top Rebbitzins. In the merit of this class, may Hashem watch over all the Jewish people and give enormous strength to the IDF soldiers, including Hanina Daniel ben David, Dalia bat Alexander, Dan Yitzhak ben Michael Halevi, and Daniel Alex V. ben Chaya Kayla. Please click on the subscribe button to subscribe to us on the America's Top Rebbitzins YouTube page, or click follow to follow us on your podcasting app so that you're the first to know when an inspiring new episode is posted. Today, I'm happy to welcome Diana Isaacs. Diana is an endocrinology clinical pharmacy specialist, and she serves as the co-director of endocrine disorders in pregnancy and the director of education and training in diabetes technology at the Cleveland Clinic Endocrinology and Metabolism Institute. Thank you so much, Diana, for being here. Please tell us more about yourself and what you do.
Sure. Well, thank you so much for having me today. So I am a pharmacist by background and also a certified diabetes care and education specialist. And unlike a lot of the times what you think of a pharmacist dispensing medications, I'm actually on the other side of it, where I have a collaborative practice agreement and I'm actually prescribing medications and adjusting medications for people, including what we're going to be talking about today, the GLP-1 agonists. And then I also help a lot of people with both diabetes and overweight and obesity navigate through nutrition, as well as using different types of technologies like continuous glucose monitoring. And I do a lot of management in pregnancy as well.
Wow, that's so interesting because usually think of the pharmacist, you go to the pharmacy and they hand you your prescription, but you actually do the prescribing.
Right. I'm on the other side of it. I'm actually in an outpatient clinic working side by side with the different physicians.
That's very cool. That's really, really cool. And I'm actually very grateful to you that you're here today because about a month ago, I did a podcast on Ozempic, Ozempic and Zepbound and Wegovy and those GLP-1 drugs. And so many women had and still have questions about these drugs and how they work and whether or not they should take them. And many of them have sent me questions about this medicine, which I would like to ask you today, if that's okay with you.
Yeah, I would love to talk about it.
But before I get started, and in case somebody didn't hear that first podcast that I did earlier about Ozempic with Dr. Adrian Udim, I want to make sure that we're all on the same page. So can you please start us off by explaining to us what Ozempic is and what it does, and the type of person who would most benefit from it?
Sure. So Ozempic, the generic name is called semaglutide, and it is a drug called a GLP-1 agonist. There's also that people may be familiar with, like tirzepatide, which is Mounjaro or Zepbound. And these drugs are really quite amazing. So the body naturally produces this substance called GLP-1, but in people with type 2 diabetes and likely also with overweight and obesity, they don't make enough of it. And so by taking this drug, you're getting more, you're getting what we call super therapeutic doses. You're getting more than the body could make. And this drug does several things in the body. So it increases insulin in response to food. So that's generally a good thing for diabetes because that will lower the blood sugar. Now, it only does it if the blood sugar is high. So these drugs are not expected to cause low blood sugars or hypoglycemia. In addition to that, though, it also slows gastric emptying. So that helps to promote feeling more full and also helps to prevent the blood sugar from spiking up too high after eating. And then there are even direct effects in the brain where it just signals to feel full more quickly. A lot of people will say it helps with that food noise. They're just not thinking about food all the time. And then there are also these GLP receptors in other areas of the body, like the heart. And so what we're finding is that these drugs also have benefits in terms of cardiovascular, where they are able to actually reduce heart attacks and reduce strokes. So much so that these drugs are indicated for people with diabetes and people with overweight and obesity that have cardiovascular disease. These are drugs that we want to use for those indications. And then one more thing, recently we found that Ozempic also has benefits for the kidney as well. So
Wow.
it actually recently got a new FDA approved indication for people with type 2 diabetes and kidney disease because it protects the kidneys.
And how does it protect the kidneys? That's so interesting.
So having high blood sugars or high blood pressure over time can do damage. And so likely one mechanism is that by helping that, it's helping to reduce the kidney disease progression. But there's likely other mechanisms that we don't even fully understand, because when they tested this, they found that the kidney function actually improved over time, and that's how they got the indication for it.
Ah, so this is through tests and studies. So Ozempic has just really been tested and studied.
Right. So randomized controlled trials are like the highest level where you compare it to a placebo or another drug in a large trial with a lot of different people. And it's been shown to be better than, certainly better than placebo, but even better when it went head to head with other diabetes drugs and other weight loss drugs.
Okay. And this is specific to Ozempic. And in the earlier podcast that I did about these weight loss drugs, we also spoke about Zepbound, Mounjaro, and I think Wegovy we also mentioned. S-
Well, some of this, so a lot of what I just said is specific to Ozempic.
Right.
But Wegovy, which is basically the same drug, it's just a slightly higher dose, that actually also has an indication for people with cardiovascular disease. They have proven the benefit in that population. So tirzepatide, which is Mounjaro or Zepbound, that drug's a little bit newer. It first came out in 2022. So it is being studied for all of these things, but we just don't have, the trials are not fully resulted yet. There is one recent indication for sleep apnea. For people that have overweight or obesity with sleep apnea, they recently gained the approval for that, showing it benefited those symptoms, likely related to weight loss, but who knows if there's other receptors involved as well.
Very nice. And so what type of person would benefit? Maybe not just from Ozempic, but for, generally speaking, the GLP-1 drugs.
Well, a lot of people could, based on all of these different indications. And actually, the latest research showed that 1 in 8 people, or 1 in 8 US adults, have actually tried this drug. So that's quite
Wow.
a lot of people.
Yeah.
When you think about rates of diabetes, there's over 14% of US adults that have diabetes, and this is quickly becoming a first line drug. Certainly, anyone that has diabetes and also has kidney disease or cardiovascular disease, this has now become first line drug. In addition to that, because there's more weight loss with this drug and people with type 2 diabetes benefit from weight loss, that's why this is often just one of the first line drugs we're going to use. Now, when it comes to people with overweight and obesity, so the latest research shows 70% of people have overweight or obesity. So it is quite a large number of people. Now, this is approved for people that specifically have a BMI over 30 or over 27 that have other conditions such as high blood pressure, or may also have diabetes, or maybe high cholesterol. So really, there's a lot of people that can benefit from taking this. I would say, especially if someone has a weight related condition, such as they have osteoarthritis or they have sleep apnea, that, or they have cardiovascular disease, that is going to be a much stronger indication to take it for weight loss. And in fact, Medicare, which is like one of the very large insurance payers, they now will cover Wegovy if someone has obesity and cardiovascular disease. And then they've been covering Zepbound if somebody has sleep apnea with obesity. So we are seeing better coverage for these drugs as well.
Wow. And that's from Medicare, specifically
That's
Medicare.
Medicare. And that's important because a lot of times other insurance plans will follow what Medicare does. There are some plans that will cover it for anyone with obesity, but I would say that's still less common. A lot want to see that it's obesity plus some other condition. And some, unfortunately, like a lot of Medicaid plans, are still not covering it for weight loss.
Okay. So it's not for sure that everybody will get this drug covered, but it's definitely worth checking.
It's worth checking because there are a lot of benefits, and there's a lot of indications now for taking it.
Beautiful. I love that. That's good. That's actually really, really good news. I didn't know that. So now that we understand everything, we're on the same page. So let's start with the first question that was submitted to me. So the big one, do I have to be on this medication for the rest of my life? I mean, that's really the question. If people take Ozempic or Wegovy, Mounjaro to lose weight, what will happen if they stop taking it? Will they gain the weight back? And in order to see continued weight loss, or at least continued weight maintenance without gaining weight back, do people need to be on these GLP-1 drugs for the rest of their lives?
This is a very important question. And what we have seen so far, and there are actually trials where they had people on them and they took half the people off of them and left the other half on them. And what happened to the people that went off of it? Most of them gained almost all of the weight back. And so it's a big risk to go off of it that you will gain the weight back. And they truly are meant to be chronic medications for the long term. Now, does that mean every person that goes on it is going to gain the weight back? Not necessarily. These drugs should be used along with healthy lifestyle changes. So it's going to reduce the food noise. That's a great opportunity to learn healthy habits with eating, with regulating portion sizes and trying to have healthy, well-balanced meals. The other thing is it's really important the role of exercise. So one of the things that does occur with weight loss, and this occurs with any weight loss, not just with Ozempic, but in addition to losing fat, you do lose some lean body mass. Now, in a perfect world, we would just lose the fat, right? But
Yes.
unfortunately, some muscle comes along with it, and it's about 30%. So it's really
Wow.
important to try to preserve that muscle as much as possible and do some type of strength training. And that doesn't mean like lifting super heavy weights. There's a lot of different types of strength and core training you can do, like in your house, like doing push-ups and stuff. Even chair exercises with like little weights can help. But you've really got to do something. And the other thing is that what the data shows is that for people that lose a lot of weight and then gain weight, they don't gain back all their lean body mass. So that's actually worse than not losing weight at all, because it ends up that if you lose weight and then gain the same amount back, most likely you're going to have a higher percentage of fat and less lean body mass. So these are the things that I want people to be aware of, that there are going to be risks, but certainly it's possible with a good exercise regimen and kind of meal plan. I think it's possible to come off of these.
And I really love that you emphasize like the healthy lifestyle, the exercise, the strength training, the portion control. I think that's so important because yes, just full disclosure, I've never tried any of these drugs, but from what I understand from people who have, it does reduce the food noise. You're not thinking, okay, where am I going to get my next meal? I want my coffee. I want my chocolate bar. We all have this food noise in the back of our head, especially, in the afternoon slump, 3 or 4 o'clock, we need a little pick me up because we're losing energy for the day. And, I love what you said about just if you institute a healthy habits, we can use these drugs just to assist us to eliminate the food noise and to instill and really install in ourselves conscious and healthy eating habits and lifestyle habits.
Definitely. And I think we're still learning on the best approach to stop these. What I would say is I definitely would not just stop it cold turkey.
Right.
I would come up with some strategy with your healthcare team about reducing the dose or even reducing the interval instead of taking it once a week, trying to prolong it. But all of this is very off label, and we're still kind of trying to learn the best approaches to stopping it.
Right. And how long has Ozempic been on the market? Because I know there's been clinical trials.
So I believe since 2017. So we have
Okay.
had that one a little bit longer, versus the Mounjaro, which was 2022.
Okay. Okay, and that makes sense. I mean, really, because the next question is anyone concerned about the long-term effects of Ozempic? Do we know enough about Ozempic to know how safe it is for people who take it on a long-term basis or even on a short-term basis? People want to know, is this a safe drug to take?
Yeah, it's an important question. And even though Ozempic's been out since 2017, this drug class as a whole has been available since 2005. The first one was a drug called exenatide or Byetta. And that one it's actually still available. It's just not commonly used because it's a twice a day drug compared to a
Wow,
once a week drug, right? And I
a
don't
big
think anyone
difference.
really wants to inject themselves twice a day.
No.
Now, overall, what I would say is these drugs are very safe. And the fact that we have these cardiovascular outcomes are very important. In fact, older drugs had showed greater risk of things like heart attacks and strokes. And for that reason, the FDA now mandates that these drugs show in clinical trials that what their cardiovascular outcomes are and that they're safe. So they are all being tested for that. And so I feel very comfortable with their long-term safety. There are side effects though, and that's important to understand. The biggest ones are actually the what we call the GI, the gastrointestinal side effects, which include things like being very nauseous and queasy. That can lead to throwing up. That could, because of all the appetite suppression, someone could get dehydrated if they're not drinking enough water. There are some more serious side effects that you will read about on the label. One that scares a lot of people is this one about thyroid cancer. And that certainly sounds scary, but I think there's a lot of misconceptions about this. So, what happened is that in rodents, high doses of these drugs caused a very rare type of thyroid cancer called medullary thyroid cancer. Rodents have a lot more GLP-1 receptors on their thyroid. Humans have much less. And so this has not been really observed in humans. Or I should say, there hasn't been a link in humans that we're aware of. And people with other thyroid conditions really should, there's not a link to it. But it is important to understand that that black box warning is there. And because that thyroid condition is highly genetic, if you have that or you have a family history of it, we don't want to take any chances and you should not take it. Other things like pancreatitis, we're still not sure 100% that there is a link there, but there have been extra cases reported. And then the other, I would say, more serious side effect that's been reported in clinical trials is an eye condition called retinopathy. And that was in diabetes, especially because if you have very high blood sugars and you lower them very quickly, that can actually initially worsen the eyes. And so for all these reasons, these are not common things, but for all these reasons, you want to be under the guidance of your healthcare provider when you're taking these medications.
It's for sure, right. And like you said earlier, you can't just stop cold turkey. Like you can't just decide I'm going to stop taking them. You should do that in consultation with your doctor, with your healthcare provider.
Definitely, because you're going to worry about rebound weight gain. And then if you're taking it for diabetes, you're for sure going to have rebound higher blood sugars. And so you'd want to come up with a plan to address that as well.
Very smart. Yes. Yes. And so the next question is, why can't Ozempic be prescribed for perimenopausal or postmenopausal women to help them temporarily curb weight gain? Or maybe it can. Women tend to gain weight during this time in our lives, and it can definitely be mentally challenging to see yourself going from having a slim figure to gaining a visible amount of weight in a relatively short amount of time, specifically in your belly, in your abdomen area. So, why can't women use Ozempic to put a stop on this very frustrating menopausal weight gain?
Yeah, so I think the answer is it depends. So if someone is going through menopause and they meet the criteria for using this drug, meaning that their body mass index is over 30 or it's over 27 and they have high blood pressure or diabetes, then actually they meet criteria for using the drug. They absolutely could be prescribed the drug. And then it's just going to be a question of maybe as these symptoms resolve, can they come off of the medication?
Right.
Which I would say is worth a try in that situation. Where I think it's more challenging is if someone has a BMI that is normal or kind of in that range, it's like 26, 27, like they're not really meeting the criteria for it, but they just want to use it to really prevent that weight gain. That has not been studied. And so we just that's not an indication. So it's unlikely insurance is going to cover it. And we just don't know. We don't know how the outcomes would be. And what we wouldn't want to happen is that a person takes it during this time to curb that weight gain and then stops it and then ends up gaining much more weight than maybe they would have if they didn't ever take the medication. And so these are the things we just don't know yet until it's actually studied in this population.
I know the study's continuing. I know you said it's been studied, but were they doing continuous studies on all of these drugs?
Yeah, I mean, they're continuing to study all these things. And then the other thing that happens once a drug is approved is something called real world data, where it ends up being used off label for all these things.
Yes.
Because prescribers can use their discretion to say, well, I want to go ahead and try this in you.
Right.
And so then we collect that information. And if we find out, oh, it's been used in menopausal women with BMIs of 25 and had these great benefits, then we learn it's okay, it's safe and effective to use. But at this time, it's I think it's too early to know that.
Right. It hasn't been prescribed enough in that type of situation yet.
Right.
And that makes a lot of sense. Wow. Okay. And we have one last question, but before I ask that one, So when we talk about like prescribing it and doctors and healthcare providers, what types of doctors can prescribe this? Like, does it have to be specifically like an obesity doctor, or can it be an internist, or like what kind of doctor prescribes these medications?
Yeah. So, I mean, it can be a wide range of doctors. So, definitely, there's not an obesity specialist. That's great. But there's not enough obesity specialists to treat
Right.
everyone with obesity.
Yeah.
Endocrinologist is also great, but there's not enough endocrinologists. So, I think it's perfectly fine for a primary care provider, an internist, a family doctor can go ahead and prescribe these. And actually, these drugs, this might be more controversial, but these drugs, many of them are approved down to the age of 12. 12 for
Wow.
obesity and 10 for diabetes. So they are being used in adolescents as well that have obesity. That might be a topic for another time. But all that to say, there's a lot of different people. Now, there's probably some that if they're not treating people with obesity, then it's probably not necessarily appropriate. But I think there's a wide range. And now, because of the approval in like kidney disease, technically nephrologists could be prescribing it, cardiologists could be prescribing it, and it's got the indication for sleep apnea, so pulmonary could prescribe it. So I think that there are a lot of prescribers, but what I think is most important is that the prescriber has a relationship with the patient and knows their background. What makes me nervous is when people just go online and maybe don't have a relationship and just do like a video visit with a prescriber and get it, and they don't have that background, they don't have that relationship.
Right. That could actually be dangerous. That,
I really think it can. I mean, and
yeah.
there's also a lot of opportunity for people to say, oh, well, I have obesity, but they really don't, and trying to get it. And then there's also, I mean, there's unfortunately there's like a lot of compounding of the drugs too, and so those are not regulated the way that the brand name products are, and so there is some concern about the safety of those drugs as well.
That makes a lot of sense. And I've heard about compounding pharmacies before. Actually, my daughter once needed a special compounding for not for weight loss, for something else. Could you just describe what exactly compounding is, just so everybody can understand?
Yeah, so what the pharmacy would do in that case is they get the pure, they'd get like the pure semaglutide, and then they would mix it with other ingredients to make a formulation out of that. And the FDA has actually allowed this to occur because there's been a shortage. If a drug is on shortage, pharmacies are allowed to do this. Also, if they mix it with other ingredients that the patient may need, like some have been combining it with vitamin B12 and other things. So it's not all illegal to do. And there's some pharmacies that are great, very reputable, and do a good job compounding. The problem is that this is just not regulated in the same way that the brand name product is. And so you just don't necessarily know what you're going to get. And there's a lot of pharmacies kind of popping up that are trying to make money off of this business opportunity. And there's just some concern that they may not be following best practices. And if you're going to be injecting this into your body,
Yes.
you want to make sure that it's safe. And then there's other concerns that maybe it's safe, but it's not effective because they're not putting enough of the ingredient into it. Or some are trying to sell people on these oral formulations that are probably not going to be getting absorbed. So it's like taking a placebo. So that's a concern as well. It's just throwing money down the drain.
Right. Well, thank you for explaining to us. So really the brand named injectable that's prescribed by your healthcare professional who has a really good relationship with you, that's really the way to go.
Yes.
Okay. Thank you. So we have time for one last question. So as a pharmacist specializing in endocrinology, in your experience, what would you recommend to women who want to create sustainable weight loss, like women who really want to lose the weight and then keep it off?
That's a tough question because one thing doesn't work for everybody. And this is why there is no like magic bullet. There's no one diet plan that you can just do and it works. It's really about a long-term calorie deficit. So burning more calories than you take in and doing it in a way that you can enjoy the foods that you like and it's sustainable. Because there are so many plans out there where people lose weight. Like you lose weight over a couple of months, but it's not sustainable because you miss the foods that you really enjoy. And then it creates this, oh my gosh, I miss the chocolate so much. I am just going to eat 5 bags of chocolate every day for the next week. And then you gain all the weight back. So it's about coming up with a plan. And I would say also coming up with a way to integrate exercise into your life every day. Exercise has so many benefits. It may not cause instant weight loss, many times it doesn't, but building up that muscle and keeping that muscle, especially during the menopause years, is so important. So if you can really do those things, I think peer support helps a lot with it too. Being in an environment where there's not like tons of excess super yummy things all the time, and you have quality food that's filling and enough protein and all of those things. So it's unfortunately not, it's not a simple solution, but trying to really have those healthy habits and have them for your kids too, because growing up with those healthy habits makes it easier to do long term. And then if you drugs like the GLP-1s like Ozempic, they can be a great tool to help you. But it doesn't take away the need for those lifestyle factors.
Thank you. I really appreciate you emphasizing that because you're so right. You're so right. So thank you. Thank you so much, Diana, for joining us on America's Top Rebbitzins. And in the merit of this class, may Hashem watch over all the Jewish people and give enormous strength to the IDF soldiers, including Hanina Daniel ben David, Dalia bat Alexander, Dan Yitzhak ben Michael Halevi, and Daniel Alex Zvi ben Haya Kayla. Thank you so much again.
Amen. Thank you so much for having me.